So we're going to look at a couple of the components of a motor exam. So we have things like spasticity and rigidity, we have decerebrate and decorticate posture, and then looking at a little bit of a pronator drift. So starting with looking at spasticity and rigidity, we're going to look at the elbow, the hip, and the ankle. So starting over here with the elbow. So what I'm going to do is I'm really just looking to see if there's any catches, anything like any kind of resistance when I'm trying to move the joint. So if I'm going to test elbow flexion, what I'm going to do, I'm going to start in that position and I'm going to rapidly put the muscle that I'm testing on stretch to see if there's any catches in that motion. You would rate this on the modified Ashworth scale, but pretty much what I'm just doing is putting the rapid stretch on, seeing how much resistance I feel, if any, and then where in that motion I'm feeling the resistance. So same thing if I'm testing extension, I start in that position, I'm going to rapidly flex, put those triceps on stretch and see what's going on there. Can you lie on your back for me? Mm-hmm. So I can do the same thing with the hip and the ankle. So here in hip flexion, if I want to test hip flexion, I have the joint in the position. I would just rapidly extend it and see if there's any catch in the muscle that I'm testing. And then if I wanted to test hip extension, I start here, looking to see if there's any resistance felt in the hamstrings, and I'm just going to rapidly push it up and just looking for those muscles, any kind of resistance. The last joint that I can test is over here at the ankle. I can do plantar flexion. So here, if I wanted to test plantar flexion, I would start here in the plantar flexion position. I would rapidly push into dorsiflexion and just see if there's any resistance felt in the calf. For dorsiflexion, it's the exact opposite. I'd start here at dorsiflexion, rapidly plantar flex, and just look to see like the tib anterior or anything in the front of the thigh. Can you sit up on the side of the table for me? So now we'll look at some pronator drift. Sometimes what happens is when patients have their arms out, if they're not paying attention, it'll kind of rotate over. So I'm just looking to see if there's any rotation of the forearms. So can you hold your arms out like you're holding a pizza, trying to grab something? All right, close your eyes. And I'm just looking to see if there's any slow pronation in this motion. So I'd hold it for about 10 to 15 seconds and see what's happening. If I really wanted to challenge the patient, I could have them shake their head, kind of get their mind off so they're not actively trying to keep the supination position. Okay, you're good. Okay, can you lie on your back for me? Mm-hmm. Last thing we can look at is decerebrate and discordant posture. So in both of these postures, the knees are going to be extended. We're going to have some plantar flexion, just like this. For the upper body, for discordant, we're going to have the elbows flexed, the shoulders adducted, kind of rounded over. And the fingers are going to be in a ball. So they're kind of going to be looking like they're hugging a blanket, just laying down. To go into decerebrate posture, like I said, lower body stays the same, but we're just going to extend the elbows out. We're going to turn the arms over. We're going to flex the wrist to keep that balled fist position.